Hello, in this video we will learn about the rheumatoid arthritis. So this is the joint problem, remember, and this is the inflammation in the joint. Rheumatoid arthritis is mediated by environmental factors and also susceptible gene interaction, and the immune response involves a sequence of events. This sequence of events will lead to damage the joint, and the damage of the joint will feel pain and inflammation will increase the positive feedback loop. Rheumatoid arthritis can be progressed due to the three steps. Number one is in the lymph node. After the recognition of the dendritic cell to the adaptive immune cell, and this response increase with the pro-inflammatory cytokines like interleukin 17. And the third step is synovial macrophage may stimulate angiogenesis and leukocytes and lymphocyte recruitment toward the inflammation site where the joint is occur and going to inflammation and going to damage. Anyhow, let's begin to understand the risk factor first. The family history is important risk factor. In this way, the genetic transformation of these gene information will lead to cause the arthritis and previous joint injury as well as genetics and age factors when increase the age, women more likely than men, and obesity. Complication can be affect your arms, legs, hands, and chronic pain and inflammation. The severe pain can be happen when the rheumatoid arthritis progression. So the affected region shoulder, legs, joints, leg joint and feet joint. The inflammation will lead to hand swelling and more pain and unable to working as usual. Let's begin to understand the mechanism of the rheumatoid arthritis and how it is possible. This is the joint, this is the capsular joint. And this capsular joint here is the tendon which meets the bone to bone where the joint is occur. And this is the cartilage which that is surrounded the where the joint is meet will lead to friction decrease. And the fluid is known as the synovial fluid will also decrease the friction will release from the synoviocytes while the chondrocytes will produce. This chondrocyte is important for the production of cartilage on the region where the edges of the bones where the joint is occur, and this is the dendritic cell are present in the synovial dendritic cell it is. So whenever this damage of these due to this many reason, let's begin to understand. First of all, we will understand about this dendritic cell will recognize the antigen, and this antigen is the autoantigen, and this autoantigen will recognize to move the dendritic cell into the lymph node. Here is the lymph node, the lymphatic system, and the naive T cell recognized through dendritic cell and the antigen recognition. After this antigen recognition, it will be proliferate into the T helper 2 cell and the T helper 1 cell. Remember, this T helper 2 cell, due to the interleukin 6 production, and this interleukin 6 production will recruit the B cell, the naive B cell, in the lymphatic system. A naive B cell recognize this antigen through T helper 2 cell and will produce the B memory cell as well as plasma cell to produce the antibody immunoglobulin. This is the autoantibody will be collapse the cartilage, and this opsonization But in the case of the synovial fibroblast are present, which that is important for the production of the synovial fluid and secretion of the synovial fluid. This synovial fibroblast due to the genetic mutation will lead to proliferation and protease secretion. And also the chondrocytes is important for the synthesis of the cartilage, also present. So this proliferation and the protease secretion will lead to damage the cartilage further, and when damage the cartilage further, which that will create the cavity. This is known as the bone cavitation. This bone cavitation basically it will decrease. The synovial fibroblast is important for decrease, but it will be autoreactive to the joint, the cartilage. Anyhow, the synovial macrophage also present in the synovial fluid, we recognize through a T helper 1 cell through antibody. Antigen. Antigen is the cartilage. So the synovial macrophage stimulate due to the recognition to release the tumor necrotic factor alpha and the interleukin 1 and 16. Also, the synovial fibroblast will trigger the SIRT1 gene degradation, decreasing, and the cyclooxygenase 2 and PGE2 increase. But the macrophage release the tumor necrotic factor alpha and interleukin 1 and interleukin 16. This will lead to our stimulation, and in this way, the basically it is producing from the synovial fibroblast. So remember, will recruit the macrophage to and other things. Basically, it recruits these cytokines, and it is trigger the angiogenesis for infiltration of further, and basically neutrophil activation, a recruitment of the neutrophil and the reactive oxygen species and nitrogen species, and the myeloperoxidase and the nuclear factor kappa B will increase, will lead to inflammatory cytokines, cause inflammation. And also these inflammatory cytokines recruit the innate and adaptive immune cell further toward the infection site. So the resveratrol inhibits the production of antibodies. This will inhibit the rheumatoid arthritis, and opsonization of the cartilage will inhibit. In this way, the damaging will be decreased, and also inhibit the synovial fibroblast proliferation and protease secretion. The treatment also methotrexate, hydrochloroquine sulfate, and leflunomide, and tofactinib, and painkiller. So in this way, this is the rheumatoid arthritis mechanism. This mechanism is the autoimmune system disorder. Due to the dendritic cell recognition, the antigen go into the lymph node, and in this way the lymphatic system will produce the autoantibodies, will collapse, and after the collapsing will damage, and synovial fibroblast will decrease the cartilage. Thanks for watching. Bye.